So this is the supine routine for the legs and the feet as well. So I typically like when I flip the client over to supine, I like to take my hand closest to their feet, hand place it on their feet, hand closest to their head, and place it on their thighs, and do some nice just 1, 2, 3 compressions. So 1, 2, 3, 2, 3, 1. Now you can go all the way down. I like to kind of go all the way down to their knee. And you can do this multiple times. I typically just do this once just to introduce the touch. And then from here, typically just to set up for the typically to set up for the upper portion, I like to take my hand and place it on their shoulders and then drape the arm like so. But I'll go over this in the shoulder shoulder and neck portion. And then kind of getting the blanket out the way. And if they're cold, it's a good job to kind of good idea to cover them up. And then I like to go straight into a diaper drape, but I'm gonna show you guys both drapes first. So taking the hand towards their midline and tucking it in to their thigh. So in, a lot of people like to go out. I prefer to go in to secure it, and then taking the sheet outside their hip and placing it underneath their hip like so, right there. Okay. But for this portion, we're gonna do a diaper drape. So with that said, I'm gonna take my inside hand, scoop underneath to grab the bottom of their knee, and then I'm gonna take my outside hand and go underneath and grab the sheet. And again, you want to grab the edges of the sheet. So make sure like the edges right here. Make sure you're not grabbing like anything like here or like here. You want to grab the actual end of the sheet like so. And then you're going to take that sheet, pull it up underneath, and give a nice secure tie. I like to bring it up pretty much right where the hip is at, and I can either tuck it in here, or if I have the client arms out, sometimes I have the client to hold it for secure, especially if I'm doing a lot of stretches. But this is helps for me to be able to control my drape as needed. Okay. And then from here, I'm going to take my outside hand and go underneath the knee and bend their knee and then put them into abduction like so. Now, if the client is experiencing any like pain right through here, I typically like to put a pillow underneath their thigh, or I can just place my thigh underneath their thigh to give them a lot more support, especially if they're really tight. But typically to test that, I just press down like so. You feel any pain or any pinching or anything in that thigh? No. So Toby's good here. All right, let's get started. So once I get them undraped like so, I do some nice 1, 2, 3 compressions, going 1, 2, 3. Again, this is just the warming phase, just getting their hips nice and open. Most people are going to feel this in their low back. It feels really good and relieving tension in the low back. And do a couple compressions here. Then I take both hands together and do compressions. And you want to ensure that your fingers are out and away from the growing area. And doing some nice compressions. And then on my final one, I like to hold my outside hand on top of the leg and do some nice peeling compressions on the calf. Kind of peel off the calf. Like so. And then I'll take my fingertips and do some nice compressions over the feet. It's a good way to just warm up the leg, let the client know you're about to get to work. And then from here, again, making sure my flashlight or my navel or my hara is faced towards the area I'm about to work. I apply my lubrication. And I just go with some nice effleurage. Doing a two-handed effleurage movement. Again, I'm bending my knee. If I had a little bit more space, I would be a little bit more wider in my archer stance. But this is going to have to do for now. Through here, nice effleurage, and then I like to come through this way on the side. Just do some nice alternating effleurage on their thighs, hamstring in the thighs, and then come up with one hand and transition it into a forearm like so. And so you can do a few strokes of just this nice effleurage movement here. And this is an option to just go into a nice deep glide or compression, depending if you find some areas that needs to be worked. But in general, you just want to kind of flow into here and then transition back to your hands to then go into the calf. And I like to take my outside hand and use that to secure the leg as I just press massage the calf. Now, if this is too much for one hand, you can go into two hands and press massage the calf like so. So those are your options there. And then I like to glide into the feet and just taking my thumb and doing a nice thumb press on the feet like so. As you can see, I'm kind of taking my child hand and allowing it to also press massage the ankle, transition into thumbs like so. Just kind of flow into this right through here. And then from here, again, I just want you guys to see that transition. I slid my hand up to secure the knee. You can just simply go from here and just place your hand there, but just to add practice, start practicing flow and everything. So that's just a good tip for there. I'm gonna take my inside hand or hand closest to their midline, grab the base of their foot, and make sure I secure this sheet right here, and place my hand back on to the knee, and make sure I put their foot on my thigh, like so. Again, secure the sheet, and I'm just going to ask them to inhale. As they exhale, I'm gonna lean in for a nice stretch here. Inhale and exhale. Is this a good spot to stop right here for you? Or can I go a little deeper? Okay. That's good. I asked originally because I felt like a soft edge at first. So sometimes you'll feel a soft edge, but it's really important to ask the client first if you can go a little deeper because you may not know what their internal edge is. But Toby's strong, she can take it. All right. So after I do about 2 to 4 breaths here, I then I lean back, right, from my lunge, taking my outside hand, securing the ankle, and placing the leg just back on the table. And from here, I can apply more lubrication, a little bit though, because the leg is already pretty much lubricated. And then I'll start to do a nice two-handed effleurage of the thighs. And as you notice, I'm going in a nice counterclockwise motion, like so. Do this 3 or 4 times to come down and up, down and up the leg. And notice how I'm lunging back and forth, back and forth. And then once I get down to the ankle, I use this opportunity to transition and do kind of the same thing we did prone with the leg, but this time with the thigh. So again, I'm going up, over, in, back, up, over, in, back. So my motion is kind of like this with my shoulders. And I'm pressing into the leg and allowing myself to clear the muscle tissue and go up. And this hand is securing, so I have that force. I'm doing a little bit of movement, but not too much where I lose my foundation. And then from here, I glide all the way to the feet or the ankle. Start, use that to walk myself back down and begin to just do some nice effleurage over the feet to get the front of the feet using my thumbs. Doing the nice circular motions up all the way to the toes and then back down. Circular motion all the way up to the toes. And then from here, I just squeeze, taking my outside hand, placing it on the outside of the ankle, just for secureness. And then my inside hand naturally already goes to the big toe. So I'm gonna do some nice circle pulls, secure the toe. And instead of me pulling with my shoulder, I'm gonna lean back. Go to the other circle pulls and lean back. Go to the next toe, circle, lean back, circle, lean back, circle, and lean back. And then from here, as you can see, I'm kind of already in like a knuckle position. So from here I transition just from going like so. So all I do is flip my knuckles down from here to go into a nice knuckle glide. Then I come up and with both thumbs securing the feet, going down and up, down and up. So my thumbs are going down. My fingers on top of her foot is going up, down and up simultaneously. So I'm just pretty much squeezing the feet like so. And then bringing my palms inward to go all the way up and down the entire calf. A few strokes, circling around the ankle, and then going all the way up to the leg, grabbing the drape, taking my inside hand towards the midline, cuffing underneath that leg again, pulling the drape down. And you want to make sure you're pulling down so you keep the growing area secure. And then drape the leg. Okay. And so usually when I have the client drape like this, and this is usually when I get done with both legs. So after I do the other leg, and I'm just drape this shoulder just for dramatic effect. Alrighty. So once I have both of these secure, I like to just do some nice compressions. Now you can make sure you ask the client first to get on the table. Is it okay if I get on the table? Yes. And I'll place the knee on the table and just do some compressions, walking up and down to the hip. Now, if the client is uncomfortable with you getting on the table, you can go like so on the side of the table. And then from here, I'm going to take my hands, cuff it underneath the sheet to give them a nice tuck. I like to really like tuck them in because it's like the reminder, like when you was a kid, like you all know how good it feels to be tucked in. So that just adds to just the relaxational effect of your massage. But before I complete the tuck, I like to do a nice little rock, lift the legs up and do a nice little rock with the hips. Give them a nice little shimmy and then do a nice traction and pull like so. And again, I'm not pulling from my upper body. I'm literally securing a pull and then I'm leaning back like so. How did that feel, Tommy? Good. See, that's proof. All right, and then tuck the feet in. And then from here, we move on to the neck and shoulders.